When it comes to burnout, I feel like as busy professionals, we're all dealing with it, right? It's something that just sneaks up on you. And I know that one of the symptoms of burnout could be anxiety and even depression. Now, how can we differentiate between real burnout and if you're actually dealing with a mental health condition?
That's a very good question because there's often an overlap between the two, and it's hard to identify it yourself. And to be clear, you may not be able to identify it on your own. You may need a professional to help you identify and to separate. I think one of the first things that we can do is to find out if we're able to separate ourselves from the stressor, right? To take a break, to have some time to take care of ourselves. Because a lot of times when we're burned out, that's the first thing to go. Because you're so worried about making sure that you get things done and fulfill your responsibilities. You're the last on the list, right? So self-care is so important. And if we're still noticing that we're struggling or we just don't have what we need to be able to take that next step, then it's time to talk to someone.
I think that's very important because as busy moms, as busy physicians, we often put ourselves last. We don't go for annual physicals. We just keep powering through all the fatigue. So being able to say, wait, am I dealing with burnout? Is this something different? And getting the help that we need, I think, is really helpful.
Yes, we can't pour from an empty cup.
Exactly.
So we have to fill up our cup first before we can help other people in our lives that we need to help. You know, like they say on the plane, you have to put on your own mask before you put it on someone else.
That's true.
So it's so important that we create that space to take care of ourselves.
Awesome.